Hello everyone, my name is Vienna and I've decided to write my research paper on mental illness in our prison systems. I will touch base briefly on some types of mental illnesses you'll find in our prison systems, as well as types of crimes that are being committed by those that have some sort of mental illness, and then I will go over some types of mental health programs that are offered to those inmates in our jails and prisons. So something I found a little shocking is that about 56% of our jail and prison populations have some sort of mental illness, which explains why there are more mentally ill people incarcerated than hospitalized. So some types of mental illnesses you'll see in our prisons include depression, antisocial personality disorders, psychotic illnesses, schizophrenia, bipolar disorders, and substance abuse disorders. These illnesses happen to be seen more in the prison system, and inmates tend to have 2 to 4 more diagnoses of psychotic illnesses and major depression, and about 10 times more of antisocial personality disorder. The 2 most frequently disorders you will see is schizophrenia and bipolar disorder. Fact is that mentally ill people are more likely to be incarcerated for some sort of violent crime. There are many different kinds of crimes that are being committed by those with some sort of mental disorder or illness. And in our state prison system, there's about 13% of inmates with mental illnesses that are incarcerated for murder, about 12% for sexual assault, 13% for robbery, and 11% for assault. In our federal system, about 33% mentally ill inmates were incarcerated for those kinds of crimes. And in our local jails, it's about 30% of mentally ill inmates who committed those types of violent crimes. So once someone is sent to prison or jail, the staff will then try to attempt to assess whether or not the inmate is in danger to themselves or to others. And once that is determined, the staff will then decide what type of treatment will be best suited for the inmate. It is a constitutional right that prisoners be provided health care, which includes care for psychological disorders, regardless of whether inmates are mentally ill when they first come into prison or whether their mental state deteriorated while in prison. Either way, treatment is very important. So the big question that always comes up is whether or not inmates are receiving the proper care that they need. And if so, is their burden being placed on an already strained prison system? Lack of staff and resources may limit the care that these inmates receive. So, some disorders require more through treatment than others, like schizophrenia. Typically requires lifelong treatment involving medications, therapy, and sometimes hospitalization, compared to depression, which can sometimes be treated successfully with just therapy or medication, and is usually managed more easily than a disorder such as schizophrenia. So the treatments used on inmates are very similar to the treatments used here for the general population that are not incarcerated, like cognitive behavior therapy. And cognitive behavioral therapy has shown effectiveness with inmates. The goal of this treatment is to change their errors in thinking. Then there are the residential treatment programs, which is a method that creates a community within the prison and attempts to teach values and skills that will be beneficial when the inmate is released. So there are many programs available to inmates, including drug abuse education courses, which is about 15 hours. The Challenge program is another residential treatment program that aims to help inmates conquer addictions and work towards managing illnesses. The goal is to help inmates adjust to life in prison and also to have more success when released back into our community. So there are many programs like the Habilitation Program, designed for inmates having difficulties adjusting to life in prison, or the Skills Program, which is designed for those with cognitive limitations. Then there's the Access To program for those with disorders such as personality disorders. So whether inmates were mentally ill when they came to prison or if their mental health did deteriorate in prison, it is important for them to obtain treatment. The mental illnesses issues in our prison system is very complicated, but it is a clear, big issue that affects many people. There are many treatment options in how mentally ill inmates are handled in prison and in jail, and we need to continue to work towards properly training mentally ill inmates so that they can become functioning members of our community when they are released. All right. Thank you.